Assalamu alaikum. I'm Amna Nassar, roll number 327. I'm representative of batch 32. Our supervisor is Manfaria Salman. Our department is community medicine. Today we are going to present our research. The title of our research is Quality of Preventive Measures Adopted by Healthcare Workers to Prevent Communicable Disease in Mayo Hospital. Before diving into our presentation, I'm going to show you the outline of it. We are going to discuss abstract, introduction, objective, methods, results, discussion, and references. Now off to the next presenter.
Assalamu alaikum. I am roll number 347, and I'm going to present the abstract of our research. Our abstract has been divided into 5 titles: background, methodology, results, conclusion, and keywords. Background. As we know that healthcare workers are exposed to higher chances of exposure to pathogenic organisms, having a high prevalence rate of communicable diseases. This study was planned to assess and evaluate the quality of prevention practices adopted by healthcare workers in Mayo Hospital, affiliated with King Edward Medical University. This is a cross-sectional study, and it was conducted in King Edward Medical University from March to November 2022. A sample size of 224 healthcare workers comprising of medical students in 5th year, house officers, doctors, nurses, medical officers, residents, etc. was selected by convenient sampling. A questionnaire was circulated amongst the study group and filled after voluntary consent. The data collected was analyzed using SPS 2020-22. Chi-square test was used for inferential analysis. Alpha was kept at 0.05. Our results showed that there was about 55.9% good prevention practice quality and 38.4% bad infection practice. The healthcare workers who underwent training on infection prevention were likely to have good infection prevention practice than those who had not taken any. In conclusion, we can say that half of the study group had good infection practice. While this may seem to be a good enough number, but the proportion of healthcare workers with bad infection practice was still large, and it cannot be ignored. Further, since training programs had a better impact on prevention practices, we could conduct more prevention programs, symposiums, and mock training programs in order to better the quality of prevention practices. Over to the next presenter.
I am Atika Jannat, roll number 328, and I'll be presenting the introduction. I'll be presenting the introduction of this research. Communicable diseases is a raging problem which is faced by healthcare workers. It exposes healthcare workers to many blood-borne diseases like HIV, hepatitis C, and airborne diseases like COVID-19 and influenza. These infections affect the quality of life and even decrease the life expectancy, as it's been seen in recent COVID-19 pandemic, as declared by WHO, that thousands of healthcare workers infected with COVID-19 have lost their lives worldwide. Various studies have been conducted in the past to analyze the quality of methods used to prevent communicable infections diseases among healthcare workers. Methods that have been proven effective to minimize infection among healthcare workers are vaccine prevention, hand hygiene, post-exposure prophylaxis, and adherence to isolation precautions. There are more cases of communicable diseases outbreaks in the third world countries with low resources. An exploration in 2006 was done as a partnership developed between occupational health and infection control experts in Canada and institutions in South Africa, which showed that integrated occupational healthcare health infection control training is needed in workforce and patients alike, and it can help in preventing the disease. This article will focus on the quality of prevention measures implemented in healthcare facilities for healthcare workers and the impact of such measures on the incidence and prevalence of communicable diseases like hepatitis, COVID-19, and HIV in healthcare workers. The second part of introduction will be presented by the next presenter.
Assalamu alaikum. I am Saira, roll number 325. I will continue the introduction. We will see the findings in the literature and what were the gaps in those findings. So, the preventive measures like the Islamabad Compulsory Vaccination and Protection of Healthcare Workers Act 2019 have been implemented from time to time. However, such measures are highly localized and there is still a lack of a nationwide prevention program for healthcare workers in Pakistan. And another research was made in the Sindh. According to that quantitative study conducted in a major health care, Sindh, needle stick injury has been implicated as one of the most common source of infection. Further research was made, and it, in that research, it was tried to make an assessment of the proportion of needle stick injuries and their associated factors among healthcare workers. In conclusion, preventing protocols are being revised and reinstituted, but the results of these measures remain rather unclear. This has led to an unsupervised spread of communicable diseases among the healthcare workers, which in the future may lead to a complete healthcare crisis. For this reason, there is an absolute need for further research to assess the quality and benefits of preventable measures for communicable diseases in healthcare workers to find out areas where special effort might be directed to ensure the undisrupted provision of the healthcare facilities while prioritizing the health of healthcare workers. So the objectives of our study is to determine the quality of preventive measures adopted by healthcare workers in Mayo Hospital, Lahore. Off to the next presenter.
Assalamu alaikum. My name is Umar Farouk, roll number 347. I will be presenting material and methods. First of all, study design. It is a cross-sectional study design setting. The study was conducted at King Edward Medical University, Lahore, Pakistan. Study duration. The study was conducted from March to November. Then there is sample size. The sample size was calculated by using single population proportion formula. The sample size is 234 in order to get a confidence interval of 95% and a margin of error of 5%. Now I would like my next presenter to present the remaining part.
Assalamu alaikum. The next is a sampling technique. The sampling technique that we used was the convenient sampling. The reason of the use of the convenient sampling was that it collects the data very quickly. It is inexpensive methodology. It is easy to do the research. It is low cost. It is readily available sample, and it follows very few rules. The sample selection include inclusion and exclusion criteria. The inclusion criteria was the healthcare workers, including the medical students of the 5th year, having the clinical exposure of at least 2 months, and house officers, medical officers, residents, postgraduate doctors, and nurses which were working in the Mayo Hospital, Lahore. And the exclusion were all the medical students from the year 1 to 4, all the students of the BDS and the allied sciences were excluded. Off to the next presenter.
Assalamu alaikum. My name is Amna Tariq, roll number 326, and I'm going to be presenting the next few slides on data collection. So the data collection procedure was basically done by a questionnaire that was used in a previous research that we have already mentioned in the references. We basically contacted the authors of that research via email and asked for their permission before using their questionnaire. And then we circulated this questionnaire on social media platforms and WhatsApp and email. The data collection tool was divided into two parts. The first part of the questionnaire was about the demographic features of the healthcare workers, like their age, their sex, their marital status, their profession, and whether they had ever taken any infection prevention training. The second part of the questionnaire consisted of 25 questions, and they were on a Likert scale pattern, which ranged from options of always to never. And it contained questions about infection prevention practices like their hand washing, the use of gloves and masks and other protection equipment while handling infectious materials, about post-exposure prophylaxis, about injection safety, about cough hygiene, about instrument processing, etc. And we used a Cronbach alphas test to measure the reliability of this questionnaire, and the value that we got was 0.751. And since any value above 0.7 is considered good, we can say that the questionnaire was pretty reliable. For the data analysis, we used a statistical analysis tool called SPSS, and we calculated the mean and standard deviation for the numerical values, and we calculated the frequency and percentage for the categorical values. And then we used a chi-square test for the analysis in which the alpha was kept at 0.05. Off to the next presenter.
Assalamu alaikum, roll number 327, Amna Nassar. There were a total of 234 healthcare workers, and the mean age was 26. 33% of them were male and 66% female. There are 42% of them working in OPD, 13% in gynecology unit, 12% in inpatient, 68% in medical and surgical ward, 29% in pediatrics, and 8% in OR. This could better be understood by looking at the next table. This table is basically showing the demographic features of our respondents, which are the healthcare workers. As you can see, the demographic, which has already been discussed by a previous presenter. One of the very important factor that you need to see is the profession. We had 3 doctors, nurses, and the medical students from the 5th year participating in our research. So the result of our research was 131 out of 234, which makes it 55.9%, had good infection practices, as compared to the 90 members, which is 38.4%, had a bad infection practices. Those healthcare workers who underwent training on infection preventions were more likely to have good infection practices than those who has not taken, which can be seen in the next table. This table basically is showing the percentage of doctors, nurses, and medical students from the 5th year and their percentages. You can clearly see that the doctors and nurses have good percentage, which have the good practices, as compared to the medical students, in which the 55.8% showed the bad practice. This data can also be seen in this bar chart, and you can understand very clearly that the blue color is showing the bad quality and the green color is showing the good quality. This bar graph is showing the relationship between the training of our healthcare workers and those of the quality of the infection prevention. We saw that those who underwent this training had good infection practices, which is shown by the green color, as compared to those who didn't. Off to the next presenter.
Assalamu alaikum. I'm Mantasha Zan, roll number 324, and I'll be presenting the discussion of our research. As has been discussed before, we know that healthcare workers provide a central role in diagnostic and prevention practices, and they are hence exposed to a lot of pathogenic organisms which are responsible for healthcare-associated infections. These infections could possibly lead to an epidemic, as is seen in case of hepatocellular carcinoma due to needle stick injuries in healthcare workers. In this study, we found that 55.9% healthcare workers had good prevention practice. This result is lower than the result of a study conducted in Addis Ababa, Ethiopia, where the percentage of doctors who had good infection practices was 66.6%. There's a reported gap in the quality of prevention practices between doctors and nurses, as opposed to the results of a similar study conducted in Pak Emirates Military Hospital, Rawalpindi, in 2019, which although pointed out that there was a difference, a gap in the knowledge of prevention practices between doctors and nurses, there was no significant difference in their practices. Moreover, we can further see that the nurses had better quality of prevention as compared to doctors. This could be as a result of extensive exposure to clinical environments, being at the front line in emergency care. And moreover, our study showed satisfactory results as compared to previous studies. However, fifth-year medical students had poor quality of prevention. This could be because of their limited clinical exposure. In all, we can conclude that COVID-19 pandemic has actually impacted our prevention practices to a great extent. As we know, all the studies that showed bad quality were conducted before 2019, before COVID pandemic. So we can say that COVID pandemic also provided, on a brighter side, a good chance for implementation of prevention practice, awareness programs, and extensive research, which may have actually given a rise to a betterment in quality. We can conclude that overall our results are kind of satisfactory, but we can conduct better training programs, mock training assessments, and symposiums in order to further increase the quality of our prevention practices. Over to the next presenter.
Assalamu alaikum. We used more than 15 references, but here we are only showing the few references, and we followed the Vancouver style. And this would be the end of our presentation. This is showing the individual contribution which has been made by each member of our batch. If there is any question, we would love to